So my name is Gerald Coakley. I've been a consultant rheumatologist since 2000, working in Southeast London. And these days, in addition to working 4 days a week in the NHS, I have private practices in Harley Street, in London Bridge, and in Blackheath. Why did I decide to become a doctor? Well, I've always wanted to be a doctor since as early as I can remember. I think maybe 5 or 6 years old. Medicine runs really strongly in my family. So my grandfather from Cork, he became a GP over a century ago. 2 of his sons became doctors, one of whom was my father. He was a psychiatrist. My elder brother and sister, and so far 5 of my nephews and nieces are doctors also. So it's really very much in the family. But, you know, medicine's an incredibly varied, intellectually stimulating career, which remains highly esteemed and respected, while also giving the opportunity to help your fellow human beings. So for me, it was never in doubt that medicine was my calling. Why did I choose rheumatology? Well, partly, you know, when I was at medical school, I was at the Royal London Hospital, and we had a very inspiring teacher, Professor David Blake. He was very original, very different in the way he thought about and taught clinical medicine. So he got me sort of interested. But then once I got into the specialty, I could see how fascinating it was. You know, most other branches of medicine focus on just one system, you know, the heart, the lung, the kidney, where specialists become incredibly knowledgeable about a single organ. But when you're a rheumatologist, you deal with inflammatory rheumatic diseases like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, lupus, vasculitis. And these are complex diseases that affect multiple body systems. So rheumatologists have to be really open-minded and curious about any symptoms, and we're familiar with integrating multiple different sources of information, symptoms, physical signs, blood results, immunology, imaging, you know, just for example, to come to a considered holistic diagnosis and treatment plan. The other really great thing about rheumatology is that there's been a laser-like focus on understanding basic molecular mechanisms of inflammation in the last 30 years. And now diseases that used to lead to many people spending shortened and restricted lives in wheelchairs are usually compatible with a normal lifespan and little or no disability. Working with patients to select the right treatments to control their disease so that they can get on with their lives, families, and careers is incredibly rewarding. And I've never regretted my decision. Where did I grow up? I grew up in Liverpool. It's a fantastic city. And in fact, all my brothers and sisters live there. I moved to London at the age of 18 to go to university, and I've lived in London ever since, apart from 2 years during my training when I was in Nottinghamshire. So the most rewarding things about my job, well, you know, my job's incredibly varied. I have quite a diverse professional interests. So medical education, for example, has always been a major strand. So in the last 3 years, I've been chair of education and training at the British Society for Rheumatology. Before that, I spent 10 years as a director of medical education at my NHS trust. I've also been involved in healthcare management. I was clinical director for 5 years, and I'm currently service lead for rheumatology. You know, in clinical medicine, I really enjoy working to help people with inflammatory rheumatic disease. And I've also had a long-standing interest in ME/CFS, or myalgic encephalomyelitis, chronic fatigue syndrome. And this is a much neglected area of clinical medicine. In fact, I have a Penguin book on ME/CFS coming out in September 2022, and I'm really excited about that. The challenges in rheumatology, well, just right now, we are facing big problems in the NHS. So there are major problems with what's known as workforce planning, which means having enough new doctors, nurses, and other healthcare staff to match those leaving or retiring from the professions. And that means that NHS services are struggling to meet all the demands placed on them. Waiting times have gone up, and this has led to unprecedentedly high numbers of people seeking medical care privately. And that was already the case prior to the pandemic, but you know that obviously COVID has been another major issue for services like rheumatology. We're mostly outpatient based. But during the pandemic, we had staff relocations, including myself, to wards for the first time in 20 years. We had hospital reconfigurations to deal with huge numbers of inpatients, which have had an impact on specialist outpatient services. So that's been a huge challenge, but at the same time, it's forced us to develop new ways of consulting, remote consulting, and new ways of communicating with patients. So there have also been opportunities and innovation as well as challenges. Which adjectives would I use to describe my profession? I always hate questions like this, but anyway, I'll have a go. I think rewarding, complex, fascinating.